All right, so here are a few more numbers for you, and they're not good. U.S. officials estimate that 20 million Americans have been infected with COVID-19 since it first arrived here in the U.S., and that means that more than 90% of the country, they're still vulnerable to this virus. For more on this now, we're joined by Dr. Bob Lahita. Doctor, yesterday was the deadliest day that we have seen in more than 7 weeks. It's been projected, or rather, we're projecting to reach 180,000 lives lost by the beginning of October, unless the majority of people start wearing masks. I know, Doctor, I just saw a graphic of, the states that are going up, the states that are staying the same. And in my mind, I just sort of envisioned, here in the Northeast, all of the states are basically the same. They've managed to flatten the curve. And then I was really surprised to see in Pennsylvania, where I live, that there's been a bit of an uptick. So even states that I thought had managed this thing, I'm realizing how elusive or how difficult it may be to keep a hold of this flattened curve. And so I want to ask you, how alarmed should we be by these statistics? I get invitations every week for some sort of gathering. Let's sit on the porch together. Let's have dinner outside. Let's go to the beach together. I mean, I really do get the sense that people are tired of keeping up with these restrictions, but also, like I've said before to you, don't really know what's right and what's wrong, and they figure as long as they're outside, then it's okay. And frankly, I'm quite concerned.
Yes, I think you should be, Anne-Marie, because we are desperately afraid in the tri-state area of another uptick in cases. We're still in the first wave, and if the CDC is correct with 20 million being infected, that still leaves 90% of the country, which is uninfected. And all of us in epidemiology and medicine are hoping for a herd immunity effect, where over 70% of the population has to be infected in order to provide the herd immunity that we see with influenza, and we see it we saw it years ago with poliovirus. This herd immunity is not going to happen for some time, but at the rate we're going, it may be sooner than later. And that's what we're all concerned about. There are a lot of people out there that need to be tested. And the more testing we have, in contradistinction to what is being said in Washington, the more testing we have, the lower the mortality is going to be. So you can be infected and not die based on the statistics that we're seeing.
So, Dr. Bob, it also seems that in the early days of the pandemic, there was a concern by doctors, by politicians, that people who were older or who had medical conditions, previous medical conditions, were at greater risk. But now, a lot of the alarming information that is coming from doctors, as we get to know this virus a little bit more than we did 6 months ago, seems to suggest that all different types of people are susceptible to getting violently ill, and some are in danger of losing their lives. And there's this new study out in the UK that describes some brain complications in patients that are severely affected with COVID-19. So I know that there's a lot of people out there who think to themselves, I'm young or I'm healthy, but it's proving, since we don't know a lot about COVID-19, that a lot of people are going to be severely affected and in some cases are going to lose their lives.
That's correct, Vlad, and you hit the nail on the head. We simply don't know who will be infected that will die. And we in the scientific community believe it has to do with immunogenetics. That means your inheritance of a certain kind of immune system, which may make you susceptible to really doing badly once you're infected. And you referred to the Lancet study, which looked at 153 patients, most of them older, who had multiple strokes, who had encephalopathy, who had central nervous system findings that were very, very severe. The patients survived, but they survived with some residual effects of having had their nervous system affected by this virus. So with regard to the age, it's clear that people who are older are not going to do as well as people who are younger. If you have comorbidities, that means heart disease, etc., you'll do worse. But when young people feel invincible, it's not a good thing. The wearing of a mask is essential in group events. And young people can get this virus, and many of them will die. They'll die because we simply don't know the immunogenetics of everybody in the population. And you can have 50 people who will be infected below the age of 30, and perhaps 5 of those people will be on ventilators, and some of them will succumb to the virus. So it's very scary, and people need to know that.
Let's talk about some more information we're getting out of the CDC, another report about pregnant women, that they may be particularly vulnerable. As I understand it, the information also comes with some questions. It's not really clear why these pregnant women are ending up in the hospital, but can you talk a little bit about that? I'm sure there are people that are really concerned. When you're pregnant, you are supposed to go to the doctors on a regular basis, but I imagine a lot of women are pretty concerned about that.
Yes, well, pregnancy is a special state, a special biologic state, which makes the female, the mother, very vulnerable. The vulnerability is based on her immune system. The immune system really affects various other organs like the heart, the lungs, and indeed the brain. So a mother, and by the way, we have data here in New Jersey which show that a large number of pregnant women who are infected have no symptoms whatsoever. And we also know biologically that the fetus, or the baby who's in the mother, is not going to be affected by the virus. But our concern is the pregnant mother. Her physiology changes, so she's at significant risk. And we've seen some pregnant women get dreadfully ill. It's the same thing as what I just mentioned with young people. It's unpredictable. We don't know who is going to be affected adversely that's pregnant. But for the most part, pregnant women, while they are at higher risks, tend to do better than the general population. And that's because of what happens with their immune systems to protect the fetus and to protect them more than the common or everyday unpregnant woman. So that's good news in many ways.
Doctor, let me ask you about the level of misinformation and conspiracy theories out there. Given that the President of the United States refuses to wear a mask in public, and that is a recommendation that comes from his very own coronavirus task force that has recommended that Americans wear masks to try and contain the virus. Now you're starting to see the wearing of the mask as a political football. And there are some people who are resisting wearing the mask because they say it infringes on their rights. The other news that seems to be all around sites that provide misinformation around the coronavirus is that wearing a mask will actually make you sick. That if you wear a mask for an extended period of time, you can drown in CO2, I've seen, or you can have bacterial fungal infections that will enter your nose and enter your mouth. And we've asked doctors this before on this broadcast, but I feel like we got to do it again. You and your fellow medical professionals, when you're in the operating room operating for 10 or 12 hours, you wear a surgical mask. Does anybody get sick from wearing a mask?
Nobody has ever gotten sick from wearing a mask. An absolutely absurd thought. Wearing a mask is perfectly fine. Some of our surgeons wear masks, and neurosurgeons who operate for 14 hours straight will wear a mask. No side effects, no adverse effect whatsoever. And I'm surprised that people actually bring such silly ideas up, because they'll do anything not to have to mitigate this virus. But God forbid they should get sick, and then all of a sudden everybody in the family and everybody in the town is wearing a mask. So it's really important to mitigate this virus by wearing a mask. The mask, and there are different kinds of masks. Of course, there's the cloth mask, there's the N95 mask. The N95 mask is the best mask with the tightest fit, and it may leave a mark on your face, may be a little uncomfortable, but you gotta wear a mask, and I just can't stress that enough.
Doctor,
Dr. Bob and Anne-Marie,
you were specifically addressing the issue of the mask, but I'd like to hear from you just on it personally about the whole misinformation thing. There's a viral video going around with a woman, I think she's in Florida at a city council meeting. She is irate. She truly believes that the suggestion to wear a mask and other things will make her sick. She really believes this stuff. I want to get you, as a doctor, how frustrating is it that people are not listening to the science?
Well, it's very, very frustrating, Anne Marie. And as a doctor, I come across public opinion all the time, both in the emergency room and in the clinics. And I would say that just when you think you have heard the worst of the worst, you hear it again. And when I'm on with you, I get tweets and emails saying this virus doesn't exist and you're crazy, and they say things that are even worse than that. But I just understand that the general public is the general public, and there are people out there that are trying to get their arms around a very complicated issue, and the average person just can't understand the physiology of a virus and the pathophysiology of a disease that could wreak havoc on his or her body. And when somebody is really at death's door and their families come to see them, they finally get the idea that this is really, really a dreadful situation that we're in. It truly is a plague. It's a pandemic that we haven't seen in over 100 years. And this is really, really important. But the average person still doesn't seem to get their arms around this. And it's not frustrating. It's the normal course of events. And I think that's why it's important for us to talk, to educate the public on these things, and to make it clear as to what we're dealing with.
Yeah, I note, Anne-Marie and Dr. Bob, that this has always been thus. During the 1918-1919 influenza epidemic here in this country, there was a meeting, several meetings of the Anti-Mask League of San Francisco. There were ordinances coming out from the city asking people to wear masks, and there were people who refused to wear masks. And as we know, of course, that influenza epidemic killed 650,000 people, according to the CDC, in this country. It's hard for some of us to understand why people are resistant to something like this. I wonder what it might have been like when city ordinances asked people to wear pants for the first time, or to wear shoes to protect your feet. If there was some group of people that said, you know what, I'm not gonna listen to that ordinance about pants wearing because I gotta be free, I gotta be out there. So it really is sort of bizarre. It really sort of is bizarre. Dr. Bob Lahita, as always, my friend, thank you very much. I'm sorry for the vitriol that you get on social media because you're just providing scientific data and information, but Galileo somewhere sympathizes with you.
Thank you, Vlad. Thank you, Anne Marie. It's been a pleasure.